Welcome to Health and Wellness with Dr. Ed. I'm Dr. Edmund Sulkowski, and actually welcome to our 18th season of doing a show here, and I can't believe how much time has gone past. You know, this show, Health and Wellness with Dr. Ed, is kind of dedicated to your health and your wellness and your education, because we want to empower you to be in charge of your health and wellness. Especially this time, you know, a time when the economy is terrible, when what they're doing with our energy is terrible, what they're doing with our health care is terrible. And if you're not in charge of yourself right now, you're making a big mistake. And that's why it's my pleasure to bring my good friend on this show. He's been a guest here a number of times, and he's a guest often on my radio show, Health and Wellness with Dr. Ed. That's every Saturday morning at 9 a.m. on AM 1250 The Answer. My good friend, Dr. Dennis Courtney. Dennis.
Hello, Dr. Ed.
Welcome.
Thank you for the invite.
You know, we're so lucky to have a native Pittsburgher who started out as a teacher, as an educator.
A high school teacher, as a matter of fact.
And that's a big transition in a great way, but it's actually not that much of a transition, because as an educator, you teach, you inform. As a physician, you teach and you inform and help at the same time. What made that change, Dr. Courtney?
Oh my, there were a number of concomitant changes that keep leading me in another direction. Actually, medicine's my fifth career. I have 4 other fully actualized careers, and teaching was just one of them. But I'd have to say, of all of those careers, the one thing that I brought myself that I think I just have a knack for, and that is the ability to teach. And in every one of my professions, that ability has aided and assisted me to a level that made me and allowed me to excel. Well, it's been no different in medicine. When someone comes to see me, they're not going to be out of my door for about an hour and a half, and I'm teaching from the moment they walk in to the moment they leave. They have to understand what is going on with them, and they don't get that kind of time with their regular doctor. And then they have to understand there are various ways to treat that. There's a conventional way, a way that I was taught in medical school, which I really am not keen on using at all.
Well, you're speaking of something I refer to as Frankenstein medicine, and I say that lightheartedly, but actually it has some deep meaning to it, and I'll tell you why. There is a time when you can use Frankenstein medicine. What I mean by that is you cut it away, you sew it back on, or you suppress it, and that's how they made Frankenstein. And sometimes that's the only way that you can treat somebody. But you do something a little differently, and it's something that medicine should be adopting, general, what we call allopathic medicine. And we're going to talk a little about different forms of medicine. You do a number of things, and I do this in my practice as well. The first thing you do is you listen to the patient, and you hear what they're telling you, because they know themselves more than anybody. Do you find that to be the case?
I absolutely know who to trust.
So you take what they're telling you, you listen to their signs, their symptoms, and then you look at them and you look for certain signs and symptoms. And then you look at other diagnostic tools and you come up with a plan to treat them, which is a little bit different than that cut it away, sew it back on, or suppress it. So what's the definition of allopathic medicine?
Allopathic medicine from prior to the 1920s was all over the board. In fact, the primary form of medicine was homeopathic prior to 1920. But they made a decision back then, and the decision was, and once that decision was made, it has been rock solid ever since, that the way to treat will be pharmaceutical and only pharmaceutical, and it's held true to this very day. I just find that these drugs, and all you have to do is look at your television set on any evening, and you can have the bejesus scared out of you pretty quickly by listening to the last 10 seconds of any one of those commercials. I take notice of that, and I say, there's got to be another way, and there is.
So that we term that allopathic medicine, and that's when you go to any physician, any hospital, any dentist's office, whatever it is, that's the standard form of care. It's referred to as allopathic medicine. You mentioned homeopathic medicine. What's the difference there?
Well, homeopathic medicine goes back to Dr. Hahnemann which is, by the way, the man who started the first medical school in the United States. It's in Philadelphia, and it was named Hahnemann up till about 10 years ago, okay? But he brought in the rule of likes cure likes. And whatever ailed you, to give you more of what ails you, actually turns out to be the treatment. I know it's a little confusing to hear on how that could work, but it actually works just fine. Those that use homeopathy today very well know that. But allopathy took over and changed everything and made it to be a pharmaceutically related treatment. You have a symptom, you go to a doctor, he listens to you.
And that happened with the Rockefellers and their funding of the schools and so forth. That's when it happened.
Well, when big business gets involved, and it certainly is involved. But no, listening to symptoms, the doctor thinks, how can I suppress that symptom? And he has an arsenal of drugs to help him in that regard. So if you have a complaint, your doctor listens to you, and he gives you a medicine, and your complaint goes away. You feel that you're dealing with the reincarnation of the Messiah, that this doctor is absolutely wonderful, that he's your man, that if any problems develop in the future, you'll be sure to go to him, and what he's just done is inexcusable.
Because he didn't do anything about the cause, the root cause of the disease. So you haven't lost the disease, you just don't notice it.
You suppressed the symptom. The one thing that was talking to you and letting you know how things were, he quieted it.
A good example of that would be someone that has high blood pressure. The root cause of the high blood pressure is never determined or treated. We just give you a pill that lowers your blood pressure and you take it for the rest of your life.
And by the way, thank God we have the ability to intervene in many cases where the blood pressures are so high. But there is a way to finally withdraw from the use of those drugs, and that's just not being pursued. So in my world, this is something that I do on a daily basis and have done so now for many years.
Yeah, I've always accused you of being out of the box like myself. We're in the box, but we're out of the box. So you have allopathic, you have homeopathic, and then there's naturopathic. What's the difference between naturopathic
in the
and
naturopathic world, and unfortunately we here in Pennsylvania don't really have the level of respect for naturopathy as they do in other parts of the United States. I would say in particular the state of Washington, the state of Oregon, the state of Arizona,
California,
okay.
Actually, even that bizarre state.
Yeah, Bastyr University, which is the first naturopathic school, is located in the Pacific North. And it's why the rule is that there must be a naturopath on hospital staffs, and they must be involved in all cases. We don't have such a rule, but we could, and maybe we should, but nonetheless, depending on where you are, naturopathy is frowned upon, but there are places where it's actually embraced.
A couple other states, Hawaii and New Mexico, they all have that where a naturopath operates as a physician.
Because he is a doctor.
Exactly.
He's just skilled in the use of natural, not drugs. Which, how refreshing would that be?
So you then take something that's found in nature, and all drugs are kind of synthesized from products found in nature, but you take something in nature and you put it into the body. Now there's another aspect of medicine I want you to bring up. Tell us what that is.
Well, this is the form of medicine. I was in your office one day. I have to reveal this to our listening audience, Edmund. And
he likes putting me on the spot when he can.
I have to like to do this when I get the occasion. But
I get him back every once in a while.
You come into the room and you said, hey, by the way, Dr. Courtney, we're going to be doing talking about lead on this weekend's radio show. Would you like to come aboard? And I said, well, you know, Edmund, you don't need me for lead. You're pretty good on these toxicity issues yourself. But I will tell you there's something that you'll want to bring me on the show for, and I'll ask it to you in this way, Edmund. I believe I'm going to tell you a medical term, and I know you're pretty smart, and I know you know an awful lot about other forms of medicine, but I believe I'm going to lay a form of medicine on you that you've never heard of. You were intrigued by the challenge, I could tell. And so I said, well, the name of that form of medicine is known as Anthroposophic medicine. And then I watched your jaw drop because you didn't have a clue.
That's a term I hadn't heard.
Anthroposophic medicine. So it didn't surprise me. Nobody's heard about anthroposophic medicine here in the U.S. But let me tell you that in other parts of the world, anthroposophic medicine is highly developed and highly regarded. I turn particularly to the European continent, where anthroposophic medicine is found and very commonly used through their approach with treating all diseases, just like allopathy, osteopathy, naturopathy, homeopathy. All these forms have their own approaches. Well, the anthroposophic form has its approach too.
So what's the definition of it?
This is a case where not only your physical well-being and your disorders weigh in heavily, as they certainly do in allopathy, but it's your personal, it's your spiritual, it's your psychic, it is your cultural, it is your socioeconomic. All these components are taken into account when developing treatments which are natural. They do not use drugs, but they need to have all that knowledge to be able to write their prescription for how that's to be treated. And I think it's so intriguing to be able to have pursued this now to the point where I'm very familiar with anthroposophic medicine, and it's now something I include in my office practice.
Dr. Courtney, we're going to take a break here in a minute. And when we come back, we're going to talk about something specific that can be used. Something called mistletoe. We'll be back at Health and Wellness with Dr. Ed with Dr. Dennis Courtney. Welcome back to Health and Wellness with Dr. Ed. I'm Dr. Edmund Sulkowski. We're here with Dr. Dennis Courtney talking about a specific branch of medicine, something new to the area. In fact, Dr. Courtney brought it to this area, and he's the only physician here prescribing this new form of treatment. And what's that term, Doc?
Okay, the form of medicine is known as anthroposophic medicine.
Which is not a
household name. No,
you know,
it's one you've never heard. And by the way, I don't believe there are any doctors in the United States that really understand that term. But we're not talking about the United States now. Other parts of the world utilize anthroposophic forms of medicine in their treatment of patients for whatever diseases they may have. But there's an offshoot of anthroposophic that caught my attention.
So before the break, I mentioned this term, and I said mistletoe. Now everybody has that, I know they conjured up in their head and said, okay, Christmas time, a little thing that we stand underneath to get a little kiss from somebody. That's not what we're talking about.
We are talking about mistletoe in terms of the plant. It grows all over the world. In the United States, we have a form of mistletoe. By the way, I'm sure it caught everybody's interest. So in the middle of winter, all the trees appear dead, but yet there's this plant growing on what appears to be a dead tree that's vibrant, that is very flowery, has white flowers. And the female version, because there are male and female mistletoe plants, have berries. And so I guess one of our pioneers looked at that plant and said, you know what we ought to do? We ought to cut a piece of that down and just put it over the hearth of the opening to the kitchen, and we ought to kiss under it. That's as far as it went in the U.S. But there are other parts of the world that looked at that completely different. And Europe was that part. And they began utilizing mistletoe medicinally, and then found there were various disorders that mistletoe could be helpful in. And then they zeroed on the number one reason to use mistletoe therapy, and that is in the treatment of cancer.
So in Europe, they've been using a form of mistletoe for treatment of cancer. With chemotherapy or in place of chemotherapy?
Predominantly, because I'm talking about the oncology world of Europe. And in the oncology world, for the most part, they're using their normal chemotherapy that all oncologists use, but they actually combine it with mistletoe therapy to get a benefit that they cannot get with the use of their meds.
So we're not suggesting that you go chew and eat mistletoe or take a mistletoe capsule, because they're actually toxic for you.
No, we're not talking about anything edible here. In fact, with mistletoe as a plant, in recorded history, there have been 2 deaths from mistletoe therapy, the ingestion of, in the form of drinking a tea. And these 2 people drank this tea chronically, looking for some medicinal benefit. The benefit to them was they succumbed to this product. So we don't ever recommend that this be eaten or in any way taken orally. Its use is delivered either subcutaneously,
which is
or
under the skin,
or intravenously.
Under controlled conditions,
under
and
controlled conditions,
dosage.
Under specific management by a doctor who's trained in this therapy.
Which is Dr. Dennis Courtney here.
Well, be doggone now. For many years, I think it would be fair to say that the number 4 reason that I'm consulted with in my entire medical career as an integrative medical doctor has been to help people who have cancer. So this is very common to me. This happens quite frequently. And I run into the patient who maybe just got diagnosed yesterday. They'll come into my office and they're very emphatic. They say, look, they're not even doing the surgery. They're very emphatic. I'm not doing the surgery. I'm certainly not doing that chemotherapy, and I would never consider radiotherapy. And that's what they announce. They say to me, what are you going to do? Well, I can tell from how well-defined they are about how they feel what I'm going to pursue, and I'm fine with it. So if that's what they want, I'm okay.
Because there are some modalities, tell me if I'm wrong here, IV vitamin C is helpful. I would think that ozone treatments would be helpful.
Very helpful.
There are a number of things that you can do to stimulate your immune system and not only kill the dividing cells. Cancer is nothing more than a cell that's gone haywire and it's over dividing. It doesn't know when to die. So there are a number of things that you could do to regulate your body to do that to get rid of that cancer. Yeah. This mistletoe is a whole new thing that's a big adjunct to this.
It truly is. So for those years, we've done well. And by the way, by far the most common patient I see, I described to you that rare person, but more commonly, I find someone who just had the surgery, that was diagnosed.
Because if you've got a tumor, that's your body protecting. That's what a tumor is.
I'm always in favor of the surgery.
Get rid of it. Cut it out.
The public doesn't know that in order for a surgery to take place, after they're scanned, there cannot be any evidence of any metastatic activity any other place. And so there only can be one lesion in order to qualify for a surgery. The public doesn't know this. This is the rule. Because otherwise, surgery is only considered to be curative. And if you have 2 or more lesions, it is not curative and therefore cannot take place. So if you're fortunate enough to have a surgery offered, I'm in favor of that 100%.
Yeah, I think people, when hear the term tumor and cancer, they think that tumor is the cancer. No, the tumor itself is your body surrounding that cancer and trying to protect you from the invasion. That's what the tumor is. And
yes, and the tumor, of course, breaks all rules of metabolic processes, and the DNA just duplicates at such a rate that this becomes a growth, one that continually enlarges and impinges on tissue, doesn't allow it to function.
And there's such an increase in the diagnosis of cancers, all forms of cancers. 1 out of 2 people in their lifetime are expected to have cancer. Think about it.
We're watching it happen in front of our very eyes.
Mm-hmm.
Every single one of the people listening to me today either has cancer that's already struck in their family, a loved one, a very close loved one. If not in their immediate family, then in the distant family, and certainly in friendships over a lifetime. This is going to be encountered over and over and over again. And so the model that we have of finding if it can be surgically removed, once removed, the patient is offered, strongly offered, chemotherapy and also radiotherapy. So we have these 3 things that we do. Our oncology department leads these 3 things, and our results, I don't believe, are very good at all, and I think statistics back me up on this. So it had been learned by the Europeans that when mistletoe therapy was introduced into the oncology world, that patients, number one, had a quality of life that they could not have had if they had just received the chemotherapy alone. One of the listeners can only think of that last person they knew with cancer. I can't ever remember a patient telling me how wonderful chemotherapy was. This is unheard of. Chemotherapy is devastating to those that have to receive it.
Well, it's taking a cancer-causing agent to
wiping out all the good tissue along with, yes, it does kill tumor cells, but it kills every cell that comes in contact with. And the devastation that is wreaked in its wake ends up allowing a patient to just not have any energy, having all sorts of pain and discomfort. And so everybody listening to us today knows that very well as with radiotherapy. So we know oncology and what they're going to do, but in the world of anthroposophic medicine, and in particular in the use of mistletoe therapy, a person can go through these steps and have their quality of life maintained, meaning they can actually enjoy life. Do we know anybody taking chemotherapy that's enjoying life? I've never run into it.
No, usually they're sick afterwards.
They are, and then we see them as time moves on, literally go into cachexia. They wither away. It's just a terrible thing to watch. And no, I wouldn't wish this on my worst enemy, but it's happening to families all over the world, and in particular, too, in the United States. So mistletoe therapy is a way that takes and allows oncology to do what oncology is going to do, but in doing what they do, they can still have a patient that's vibrant, that enjoys life. Can you imagine this? That enjoys life. And occasionally you may have heard of a pretty affluent American who's diagnosed with cancer say, you know what, we're going to go over to Europe and find out what type of therapies they may have over there. I've heard this many times, and it usually takes someone who's economically well off to do it. But what they're going for, and they never seems to get back to us, they're going over there for the anthroposophic medicine. They're going over there for the mistletoe therapy because their numbers of, number one, quality of life and survivability are far in excess of what we do here in the United States.
So Europe's been using it for a considerable amount of time.
It's been in part of their, anthroposophically, it's been used over 150 years. But with respect to cancer, mistletoe therapy literally began in 1920 when a scientist by the name of Adolf Steiner from Germany discovered how to process the mistletoe plant, and his processing technique yielded an extract, because that's what's used, yielded an extract that contains properties that are able to allow patients that maintain that quality of life and literally have greater survivability. So Steiner's invention of how you process the mistletoe to get an extract is the same way it is processed and extracted to this very day. And these forms of extracts are available, FDA approved. FDA knows all about it. In the United States, there's only one pharmacy, only one, that distributes those extracts to doctors like me.
So is that one plant fits one size, all cancers? How do you know what you're getting there?
This was amazing to me. So what actually my job has to be is I have to pick the tree. There are so many forms, and by the way, the only medicinal form that we're talking about is the European version. In the United States, we have a phyto form of it, which is not medicinally appropriate at all. But Viscum album is found in the European mistletoe plant, and that Viscum album is the extract that Steiner was able to pull out of the plant, and that's what we administer, both subcutaneous and IV, to get the result.
So what do you mean, I picked the tree?
So a patient comes to me, anthroposophically, I need to know about all those components I told you about, the spiritual, the cultural, the socioeconomic, the medical. I have to have their entire medical record about what's being done to them. I need to know their cancer, and I need to know where it is. Every one of those aspects play a role in allowing me to decide which tree to pick. Why? Because each form, each tree, and the extract that comes from it has a variation of the two main components that allow us to get a medical benefit. One of those are known as viscotoxins, and the other ones are known as phenols, okay? So between those two components and the variation of the amount of each, depending on the cancer, the patient, and the location, I pick the tree, and then we use that extract to find the dose.
So how many trees are you picking from?
There are over 63 trees that are currently extractable. There are only 3 companies in the world that follow Adolf Steiner's protocol for extractions. And so therefore, even though there are many more companies that put these out, there are only 3 that make an anthroposophic form, which the rule is to use the entire plant. The other people use components of the plant. So with that being said, we're sticking with the 3 companies that use anthroposophic processing, and there are 63 trees to pick from, and based on those factors, I'll end up determining which tree it will be.
So you're looking at if somebody comes to you and says, I just was diagnosed with lymphoma, form of cancer. So you're looking at their medical records, you're looking at their family life, you're looking at every medicine that they take, every supplement that they take?
I'm looking at all of it.
Everything.
Plus, you missed 2 other things that I think, or one other thing for sure, okay? And that is that the patients lose their diurnal notches for a couple of things. Number one.
Wait a second. What's a diurnal notch?
Okay, so
we have to tell our audience.
Talking about body temperatures.
Okay.
You understand that in a human being, when you wake up in the morning, your temperature is the lowest it will be all day because your engine has been on idle all night. By the time 11 o'clock rolls around, you're at the highest temperature you're going to be all day. Around 2 o'clock in the afternoon, there is a decline in your temperature, and by the time evening rolls around, your temperature is back up. So there is a diurnal notch in every single one of us who are healthy. A cancer patient loses their diurnal notch. When they plot out their temperature is flat. And the reason that it's flat is that all their hormones, which control this diurnal notch, are completely in a state of flux. And they're all out of whack. And when they go out of whack, your diurnal notch leaves you.
Okay, so if I wake up at 5 in the morning and I take my temperature and I get a reading of 97, I'm just throwing numbers out there. And then I take that reading again at 11 o'clock, I should be 98, 90, I should go up.
We know even a little more about that, Edmund. I mean, we've determined that the normal walking around temperature is 98.6, right?
That's what they say.
That's what they say. But yet a normal person who awakens in the morning never has a temperature of 98.6, but he better have a temperature of at least 97.8 or higher. So that's your lowest of the day, and it sometimes goes down to those upper 97 area. So between 97.8 at 11 o'clock, you'll be at 98.6, but there'll be a slight decrease later on in the day and a slight increase later on after that. Diurnal.
Does it have to do with eating cycles?
It has to do with your hormones. In particular, by the way, how about thyroid
hormone?
Well,
I'm leading there. Okay. So we know the impact the thyroid has it, and we know the impact that the thyroid has, but it's actually the hypothalamus that controls our body temperature, even over that.
But it is controlled by hormones themselves. So these hormones, and what about the cortisol levels? It's another thing that weighs into this. So knowing their temperature variation is important to document when we start, because one of the things I expect is not only is their quality of life going to be restored, which is probably absent now because I've already started chemo, I'm going to be able to see the restoration of their diurnal notch.
So if you have a flat line temperature reading,
and people with cancer do,
it stays the same, that should be a big alert, a big red flag for you.
Well, it's not a red flag. It's anticipatable. I see the cancer patient, and when I have them take their temperatures, it's flat.
Now, I guarantee you, after people have listened to this show,
maybe they'll take their
They will be taking their temperatures, I guarantee it.
Okay.
So if somebody does that and they say, okay, I'm 97, 97, 97, 90, they need to
well, it depends on what time of the day. If they're 97 right out of the chute in the morning, I can call that normal.
No, I'm talking about 97, then at 11, 97 at
that's right. If
1 o'clock, 97 at 4 o'clock.
They're not well.
Okay.
I'm not saying they have cancer.
They could have a thyroid issue. They could have a hormone issue as well.
That's right.
The point I'm making here is we don't want to say, okay, you're flatlined, so you have cancer. No, but that's something that red flags you to
there's a problem.
You better be looking.
The point I made was anybody with cancer absolutely has a flat.
And that's any form of cancer.
Any form of cancer.
Whether that be prostate cancer, leukemia, lymphoma, breast cancer.
It does not matter what the cancer is. And so therefore, I have quality of life to monitor, okay? I know their quality of life is terrible when I meet them. I'm going to get that back. And then I have their diurnal temperature notches to restore. So I can track easily when just talking to the patient, and they're now vibrant. When we first met, they were not. They were non-communicative. They were not feeling good at all. But now they're feeling better, and they're really appreciative, and their temperatures are starting to return. So I can use this as feedback while we're treating them and while they continue to receive their chemotherapy. So this is an adjuvant treatment in Europe. The chemo process goes onward because that's what oncologists do. We can disagree about how effective those tools are. and I have quite an opinion of my own, but we're going to forget about that for right now. If a patient decides that's what they want to do, the moment they decide it, I am behind them 100%, and they now need my help to be able to get through this, at least the treatment alone, and maintain a life. And then they deserve to have years tacked on to that life.
So we know how important the immune system is. You know, that's our innate immune system. We're bombarded by bacteria, viruses, fungi, cancer every day. We fight cancer every day. I think most people understand that. But our immune system, if it's supported and functioning properly, handles all that. Does milk thistle boost your immune system?
Milk thistle does boost the immune system.
I said milk thistle. Mistletoe is what I wanted to say. You were listening to me because you picked
But I
up
said
my mistake.
Yeah.
Yeah.
But the milk thistle actually does.
Well, milk thistle is wonderful by itself, but I don't want to get sidelined.
So talk about mistletoe. Yeah. So let's talk about how it's administered to so you can understand. Okay. So I've met the patient. I've checked all the records. I have now their temperature plotted. I'm ready to begin. So the way we begin is this patient administers their own treatment. They're going to get the extract.
That's beneath the skin injection.
They're going to do sub-Q injections on themselves.
Like a diabetic injection.
Exactly.
All right.
And the first is what we call 3 series. Series 1, 2, and 4. There is a 3, but we don't even use it. And what happens is the dose of the extract is 1 milligram to start. And by the time and there's 8 vials, each with an increased amount of dose. And there are these series, 1, 2, and 4. By the time you get to the end of 4, you're at 50 milligrams in the vial. And you're using 1 vial for every treatment. Somewhere between 1 and 50, this patient keeps administering sub-Q doses. At some point, he gives himself a dose one day, and he gets what could be described as a welt.
So that's a reaction.
It's a red area. It's hot. It itches a bit, and it's got to be at least 2 inches in diameter. When that happens, first of all, the reason that it happened is that you just remember the immune system has been crushed by chemo. That's one of the worst aspects of chemo, because the one time you need your system fully engaged, you don't have it anymore. And it's all byproduct of these oncologists doing what they do. For you to get the welt, you have switched on your immune system with that amount of viscum album, which is the name of the extract, and that becomes the patient's dose.
So once you hit that welt,
you're
staying at that dose.
They stay on that dose.
Whether it's 10 milligrams or 50.
Whatever the number is.
Yeah.
They're going to be doing these injections 3 times a week. They're going to be on 2 months, off 2 weeks. On 2 months, off 2 weeks. And they're going to keep on doing that for approximately the next 5 years. But the benefit to them is one that they would never be without, because they've learned to trust. Their well-being has now accelerated. They're willing to take on life, and now they're working for the years added on.
Can you be allergic to mistletoe?
If, by the way, you could be allergic, and in those cases, unfortunately, we will not be able to do mistletoe therapy.
So you always do a little test before the administration?
Remember, we're starting out with 1 milligram.
Yeah.
And if you're going to have a reaction, you're going to have it at 1 milligram, and we're not going to go beyond that. I have yet to have such a thing occur, but nonetheless, it can.
We have a couple of minutes left in the show, Dr. Courtney. It went really fast today. How do people get a hold of Dr. Dennis Courtney?
Well, first of all, anybody listening to me today, who either is confronting cancer themselves, has a loved one that is, or an acquaintance. Please bring this message to them. I think you know that what I described, they're going through, and they need help now. And so give me a call at my office at 724-942-3002, where we can begin to talk about how to proceed.
And all that information has been on a graphic, and you're located in?
My office, which used to be in Peters Township, has been moved. I'm now on Campbell's Run Road, right at the
Ridge Road exit.
Ridge Road exit.
Yeah.
Right where the big shops are up on top, I'm down below.
Yeah. If I wanted to boost my immune system, and I don't have cancer, but I want a good solid immune system, would this procedure protocol help?
You've already asked me this question, Em.
I know the answer, but
Okay.
I'm doing this for our audience.
And so I said to you, yeah, you're just going to find out that the dose that you're going to require to get that welt is going to be far lower than someone else, but nonetheless, it's going to heat up your immune system.
We're at the end of the show, Dennis. We'll have you back because this is an important topic and people got to hear this many times. Of course, you'll hear Dr. Courtney on my radio show, Health and Wellness with Dr. Ed, every Saturday morning at 9 a.m., AM 1250, The Answer. Thank you so much, Dr. Courtney, for coming on. Remember, a healthy pet is a happy pet. When you're healthy as well. God bless. We'll talk to you next time. Bye-bye.